So Andrew and I both work for MS Australia, and I hope by now you've met our board president, Des, and I hope by now you've met our CEO, Rowan Greenland, and our new head of advocacy, which also scoops in comms, Jeremy Henderson, sitting over here if you haven't. Often when we present, I show this diagram because I know a lot of people get a bit confused about MS Limited and MS Australia, MS Western Australia, etc. At a glimpse, I hope this will show you our state, our national, and then our international connections. So MS Australia is the member organisation of the Multiple Sclerosis International Federation, and with our research colleagues, the International Progressive MS Alliance. I hope at a glance that's shown you how the MS family all fit together in Australia. A couple of examples of the basic information that we provide to decision makers about MS. We've got lots of evidence-based material available to us. We can tailor responses to just about any inquiry we get at MS Australia and to suit just about every lobbying and campaigning opportunity. Much of this evidence comes from the researchers in this room, so another plea to support their work. Without your involvement, the researchers' work that gets synthesised, that helps our advocacy and lobbying. Here's a great example. You'll all be familiar with the Menzies Health Economic Impact of Multiple Sclerosis report. We then turn that into a key facts and figures document. That's now been translated into 10 languages. It's available on our website, and as I said, it's come from the Health Economic Impact report, which we're hoping that the Menzies will run again soon. How do we know what to advocate for? How do we identify the service gaps? When we say service gaps, we're talking about federal government, basically, service gaps, NDIS, aged care, healthcare, and so on. How do we know what your needs are? So this just is showing you the top 11 priorities, which were results from a major priority survey we conducted last year, mentioned earlier today by Viv. There was about 3,000 respondents, plus Andrew and I conducted some focus groups, plus we get ongoing feedback from people with MS, probably from some of you in the room, plus from our state colleagues, people like Jodie and her teams. These results informed the development of our strategic plan. They also informed, for example, our 2022 election commitments document. This feedback also steers our responses to government and agency inquiries, and it tells us what to focus on. Here's our strategic plan at a glance. It's easy to find on our website. We're not going to read it out to you, but just you can see the main headings across the middle of the page. So all of that material gets synthesised into a document like this. Our advocacy team are primarily responsible for the first bit, people living with MS, their carers, friends and family. We're also responsible for the education and awareness bit and the advocacy bit. And because we can't help ourselves, we involve ourselves in all the other bits as well. I'll hand over to Andrew. I will.
Hello, here's the 2022 election commitments document. Just so you can see the link between the 7 issues we asked politicians to commit to and what you, the MS community, told us. Thank you, Des. And what you, the MS community, told us you need or you would like from a political perspective. If you can remember the photo of people in the bottom of that brochure, I'll come back to that in a moment. Next one, please. Alliances are critical to progressing our advocacy work, as you would imagine, and we can't do it all on our own. Many issues affecting people with MS affect many other folk in our community. So we've got a strong link with other alliances of like-minded organisations that are represented. Next one. These slides set out our major activity, advocacy tools of trade, and as Senator Wendy Askew was here this morning, she co-chairs, as we know, our bipartisan parliamentary Friends of MS, along with Senator Deb O'Neill from New South Wales. Both of these folk, as Wendy Askew shared this morning, were re-elected. Here's a ripper. A recent example, survey of people with MS told us that we all wanted better access to MS nurses. Surprise, surprise. MSA commissioned a study from the Menzies, and the report from this study was launched at our recent research conference in Hobart just in April. The working party of the report partners is now planning advocacy activities to address each of these recommendations. There's an executive summary document in your dilly bag that you have with you, so read it with much zest and enthusiasm, please. Next one. This is just sharing for you recent and current work and some examples of them. Given the nature of time and pressure I'm under, Des, I won't read them out for you. This document is obviously available and will be, if it's not in your bag, it'll be on the website. I'll send it to you as participants here today. How to get involved, the next one. You've done that for me, thank you. We are the B1 and the B2, or the A1 and the A2 team, as you guys who know us know. To finish, how you can help us. I can't read it that far, it's too far away, but I can see it here. How to get involved, you can keep an eye on the website, follow us on Facebook, Twitter. Always happy to get feedback, so if you want to give us any feedback, email him. He's the Giles. And of all things, most importantly, given this Monday coming, for me it's two things. One, it's World MS Day. It's also my youngest daughter's birthday, so I've got two hats on Monday. That's why I'm going to fly out in a minute. But do what you can to support World MS Day on Monday. And it's very nice to see people on the happy end of the island in Launceston, given I have a persuasion being a coaster. So thanks very much, everybody.